Yeah, so my name is Michael Zuratti, and I'm the CEO of Sedation Ink.
And so, how did the idea come about to open this with Eileen? Like, where were you? Like, what kind of led to wanting to get into this business?
You know, it's a great question, Veronica. It all started with folks asking me if my tattoos hurt. I have a leg sleeve and an arm sleeve. And then that kind of raised the question of how can we solve that problem for folks who love art but don't necessarily enjoy the pain of tattooing? That's how it started. So then doing some research, we noticed that it really doesn't exist aside from the numbing cream, which is limited, right? It works for about an hour and a half during the session, but then the pain doubles once that wears off. So doing some digging into it, noticed that really no one offers safe way for anesthesia under tattooing. And that kind of got the brain going. That's how it started.
And so then you had to, I guess, like reach out to doctors and you have to get approval from the Department of Health, right? So it's like but you already have a background in working in like healthcare, right? Because of your other businesses. So maybe did that help you? Was it not as daunting because you already have some like experience in that?
So being a part owner of a mental health facility, I understood the nuances of having a medical facility as it is, getting a medical director and dealing with practitioners. So we understood that there's going to be some hoops that we have to go through to try to get that licensing, since it doesn't exist in the state of Florida. So essentially we had to get a tattoo establishment license, but we also had to get a general anesthesia license as a surgical office. So those two governing bodies are completely separate, and it doesn't exist in the state of Florida. So we almost had to pitch it to the medical state of Florida, the medical board, and kind of explain to them the process that we want to do and the fact that we're trying to abide by both governing bodies. So obviously it took a little bit of time. You know, we had our healthcare attorneys assist us with the medical board, and here we are today, operating fully legally in the state of Florida. We're very proud of it, especially, you know, hearing about some instances with other places that are doing it kind of, I guess you could say illegally. We're very proud to say that we're at the forefront of this.
And so maybe could you tell us a little bit, like listeners might be wondering, so where does this take place? And obviously this is like a high-end, fully legal business, but if you could tell us a little bit like the kind of facility that it takes. It's not like it's just some tattoo parlor in South Beach. Like it is like, you need a surgical center, right? Like, so maybe a little.
So we have our surgical office in Coral Gables. It's a facility that obviously is registered for anesthesia as well. We use medical doctors, anesthesiologists with at least 15 years experience.
So we'll go. So you're looking for physicians who've been at least 15 years in their practice.
At least 15 years in their practice, and these doctors have usually worked in hospital settings. So doing procedures such as heart transplants or liver transplants, really serious surgeries. So for them, something like this is actually, for the lack of a better term, a piece of cake, right? So tattooing is, you're barely infiltrating the skin. So for them, it's there's really no risk associated. It's just strictly anesthesia, you know, doing the screening with the client, making sure that they're healthy enough, their BMI, previous health issues, before allowing us and giving us the green light to even consider that client as for a potential tattoo.
And I forgot to ask you, when you were talking about how people have asked you about your own tattoos, were they painful? Like, is the pain was it part of it for you? Or would you say like it actually would be more pleasant to be under anesthesia? Sometimes people think, oh, the pain is part of it, but these are like, maybe tell us how elaborate, like it would be impossible to get this all like in one, like you can't do that kind of artwork. Like yours actually, did you do them in multiple visits?
Yeah. So my tattoos, my leg sleeve took about 10 sessions. I would say 4 to 6 hours each time over the period of about a year. So it is time consuming. And you know, what we do is we try to provide a service for a client where they can do a leg sleeve all in one day. So not only are they able to do it all in one day, but we're providing some of the top tattoo artists all at once. So to talk a little bit about the artists, some of the artists that we use, clients wait months, sometimes years, to be able to get a session with them. That's how booked they are. So to be able to get 5 or 6 or 7 of those guys all at once to work on your project alone is really unbelievable. Myself, from my experience, when I got tattooed years ago, I had to wait for my tattoo artist 3-4 months at a time for each session. So, you know, that's something that we're proud of and our clients really appreciate.
Right, we forget that about the tattoo industry, that these artists are really coveted and they're busy. They've got a lot of...
They're quite busy, and, you know, they've been doing this for 10, 15 plus years, and they do it at their own time usually, right? So they'll go 6 months sometimes without tattooing just because they can, right? And then they'll take on sessions whenever they want, wherever they want, right? But now it's a controlled setting where the artists understand that, you know, the doctor is in charge, and we have a strict timeline. We have about up to 8 or 9 hours max under anesthesia. The project needs to be completed, and we're all fully trained to still provide that quality tattoo even in that short time frame.
And these are artists, do the artists fly from somewhere or they live in this area?
Most of the artists live within a 4-hour drive radius. We have had projects where I've personally flew in artists from different states, depending on the style of tattooing that we need.
And then a question about your clients. So they're not a person who just like on a whim wants to get a memento tattoo on a trip, like they've had to plan for this. Can you tell us a little bit about who you are like appealing to, if that makes sense?
So most of our clients will come from out of state. These are folks that are entrepreneurs, in the Army, all types of different backgrounds. They've had their vision of their dream tattoo forever, but really haven't been able to do it, whether it's the anxiety or the pain associated or the time factor. A lot of our clients just don't have the time. They're busy with their families, they're traveling, so on and so forth. And then little things such as needle phobias. So once they find out about what we're actually doing, it's actually shocking to them. So they call in and they request a little bit more information, and then it's usually a no-brainer for those folks because we're really filling that need. That's what's so cool about our company. We don't necessarily believe in sales. We don't have any sales process or sales tactics. It's usually just an organic conversation with the client and just finding out what are they actually looking for. And if we have that solution for them, we just tell them about it, and then, you know, it's a privilege to be able to do that, yeah. And to be involved with a service where you really don't have to sell it. People are just so fascinated by it. I can't tell you how shocked I am when people tell me they didn't even know this existed. So doing things like this with you and just really putting this out to the public, we're super excited to be able to have people that would love this learn about it through platforms like you guys.
And one other thing is just about like, so for you as a business, you have to have, like, I imagine, your insurance, the surgical space, yes, the doctors. There's a lot that goes into it. I guess, is it still like a business that you can make a profit from? Like, is it? I mean, because like, maybe if you could tell us a little bit about what it might cost for a patient, and you're able to like make this a business that works for you.
Right. So right now our cost, our pricing starts at $35K and goes all the way up to, you know, over $100K, depending on the project. Most of our projects involve about 4 artists, up to 8 hours. So something like a full back tattoo would require 4 artists. Tomorrow we are doing, or Friday we are doing 2 leg sleeves. So we'll have 6 artists, 3 artists on each leg. An arm sleeve is usually 2 to 3 artists, depending on the design. So in terms of the pricing, it all is dependent on the number of artists and how big the project is.
Wow, and it takes that many artists because of why? Because
of the time, right? So we have about 8 hours to do a full back, so 4 artists can complete that project in one day.
Wow, that's fascinating. And one last thing would just be about the anesthesia. Do the patients take it well, and do they mind that they can't see the process while they're getting it done, or, you know?
So there's a myth that goes around in society that general anesthesia is very harmful or could be dangerous. Speaking to all the medical doctors that have been involved in our business, they've all said the same thing. It's a myth. There's a higher chance of being struck by lightning than something happening to you during general anesthesia.
And the other thing was just, they can't see it while it's getting done. Like, is that something they might have any concern about, or they trust that it'll look amazing when?
So we have several consultations with the client pre-procedure, and it's all about creating the dream tattoo for that client. So we're very involved in the consultation process, and our goal is really to make their dream come true. So whatever they're envisioning, we're going to stencil it out. We're going to go through it with the client over the period of a month or two prior, just so we can solidify the complete design all the way up to the day before, where the client is just like, yes, let's do this. And then the day of the procedure is just action time. And I can't tell you how amazing it is as an owner to see the reaction of the client as they're coming out of anesthesia, just looking at the artwork. I mean, we've had grown men just tear up, and it's just fascinating.
Wow, that is beautiful. Is it often that people, when they're doing something like that, and maybe from your own experience, is there usually some meaning to the tattoo and they feel really happy to see it?
Yeah, all our clients have tattoos that mean something to them. One client that comes to mind, she had her girlfriend's name and then a few things that reminded her of her girlfriend when they first met. Another client was a Republican and very big on Trump, so he did a lot of like American flag, things of that nature. So and then it just kind of depends on the client. Some clients just don't care; they really want the aesthetics of the tattoo. We have a project coming up where the client wants to do like a predator vibe. So he's going with the kind of like the apex. So he's going wolf, tiger, things of that nature within their respective habitats. So it's a full back project. So pretty cool. At the end of the day, it's what the client wants, right? It's not up to us. We're there to just guide the client in terms of what we think would look good and just showing him examples. And then, but at the end of the day, the client gets to pick.
Absolutely. And the last thing, what would take it up to say, like when you're getting towards the 100,000 mark, is it the back, or what could cause, like what starts off a little lower and then like what's a more expensive tattoo?
Right. So like a full back is just a typical, could be anywhere from 35 to 50K. When you get up to the 100K range, it's usually a full back with a leg sleeve with something else. So whenever it's two large body parts, that's when the prices kind of get up there.
Got it. And is there anything I didn't ask you that you wanted to add?
The biggest thing coming out of anesthesia is just a little bit of nausea for the first 30 to 45 minutes. After that, there really isn't pain. It's just more of the uncomfortableness of just being tattooed, right, over the period of 2 weeks. We interview every single client the day after the procedure. I personally drive over to the hotel and we do a live interview with each client. And for anyone who wants to see those, they can definitely check them out on our Instagram, Sedation Ink with a K. Every client has no pain. They're laughing. They're saying that it's just a little bit of uncomfortableness, but it's definitely nothing compared to what people assume coming out of anesthesia. Knowing that, oh wow, 4 artists are tattooing someone simultaneously for that period of time, you would think that the person would be crying the next day, and it's just the opposite. And as an owner, it's fascinating to be able to see that.
Yeah, I bet that feeling of seeing, like you were saying, that people tear up to see it. It reminds me a little like when I interviewed Frank, who I think is a client you were referencing about the flag, and he now I lost my train of thought, but he.
Got emotional? Or?
No, I don't know why I remember it, but anyway, I guess like just if you want to talk a little bit more about like people feeling like emotional about when they see what was done.
Yeah, I think specifically with Frank, it meant so much to him to be able to do that, and it just happened that our president got shot the day of the procedure, I believe, or the day prior. So it just kind of added that extra layer of emotion for him. So when he came out and saw that, it was fabulous to see. So
now I remember when you were saying that, but he was saying is that because I asked him say about making the cost like work for him, and he said it's really not different say than someone who wants to get like some kind of plastic surgery, like you do something to feel better about yourself. So maybe would you agree, like it's like when people are thinking, oh, that's an expensive tattoo, but you pay a lot when you want to have these cosmetic procedures done.
Yeah. So when it comes to the price, I would say this is something that people should look into, because if you were to compare doing tattooing the traditional way versus getting tattooed with us, you'd be surprised that the price ends up being similar. So in other words, if you had a quality tattoo artist that's charging about 2,500 to 3,000 a session per day, and you wanted to do a full back, let's say a full back is 6 to 8 sessions, that's going to come out to 30 to 40K, especially if you're going with a quality artist. Now, if you're going with any type of artist that you might know that's charging you 500 to 1,000 a day, that's fine. But at the end of the day, if you want a quality tattoo, the pricing is really going to be very similar. Not only are you now getting it done in one day, if you really value your time and you don't want to spend 8 sessions over the period of a year, not to mention the pain associated, right? Now you're taking a nice little nap in a safe environment under medical supervision with MDs and nurses on staff right there with you the whole time while you're taking a nap, and you have those top quality artists that you wouldn't have otherwise been able to get your hands on performing the tattoo all in one day. So it's I would just ask the folks to kind of look into that a little bit more.
And you know, the last thing, also you do it so that your clients don't have to worry about anything, and they're staying in the next, like the Biltmore, right? And
Yes.
it's like, so it's a whole experience. It's like an experience what you're offering.
It's all about the client for us. You know, starts from having a driver for them during their whole visit, us picking them up from the airport, taking them to the hotel, getting to know them a little bit more on a personal level, finding out why they're doing this and what brought them to us, going to dinner, comforting them throughout the entire process as it is, right? Easing that anxiety going into the procedure, you know, and then all the way to post-procedure, checking on them at the hotel. Some of our clients request a nurse aide just to kind of be next to them for 24 to 48 hours. So we provide that as well. And then, you know, just going out to lunch and really just getting to know the client on a personal level. And it's served us well. It's been awesome. You know, all our clients stay in touch. They all want to come back for their second session. So it's part of my job to try to tell them to, you know, be patient, because we do want their body to fully heal before we work on another body part.
Wow. Well, that's all I have. Thank you so much,
Thank you.
Michael.
Thanks so much. That was awesome.
I'm so glad. It seems like I bet the doctor, I get a chance to speak to the doctor who'll be there, but I'm sure it's nice for them to do, like you were saying earlier, that it's not like a